main reason for this tripartite partnership between the Federation of Uganda Employers, the Reproductive Health Uganda, and the Danish Family Planning Association is to bring issues of sexual and reproductive health rights at the workplace.
One of the things we noted was that young people who are in informal employment and those in formal employment were missing out in accessing sexual and reproductive health services, especially those in private sector. Reasons is that the private sector, because they are driven by profit, they want people to work without even the slightest break. So, and yet young people, whether they are employed or not employed, they are sexually active. They relate, they have friends, they have partners, they are sexually active. So one of the challenges was to address the policy constraints that impede these young people from accessing services.
We were having limitation of distribution of condoms by then because we have different work sites. So you find that if this site is getting another site, again we have the contractor used to buy before SRHR coming. We used to buy condoms and they were expensive.
Issues like violence, domestic violence, sexual harassment, they can't miss. But the company at that time, it had only one system it was using. A case would be forwarded, or if somebody who has been harassed could come and report to the security officer of the estate, and then it will be the security officer actually who will forward at some point the case to management, because the work has always reached to him first. If he feels he can handle himself and finish, he does and finishes.
Most of the workers living with HIV, they had stigma, and the others, they were fearing to come out in public. So you find even if someone wants to go to the health center to pick the drugs, you find someone decides to stay. Say, how will I ask my manager that I want to go and I pick the drugs? You know, you find a person has skipped, and yet they are supposed to pick their drugs on time.
In partnership with Danish Family Planning Association of Denmark, and of course working through Federation of Uganda Employers, with support from the Danish government, from Danida, we crafted an initiative. And in this initiative, we call it the promise. It offers a promise. So in that initiative, it has 4 pillars. One is addressing gender, to sensitize the young people, the communities about gender equality. The other one is focusing on the youth, SRHR, or sexual reproductive health, and youth. Interestingly, the other one was to say private sector and sexual and reproductive health and rights. And that is where the component of targeting the private sector to be brought on board. And given that we as an NGO, we may not have the full mandate to muscle and to direct policy directly, we brought in a partner, Federation of Uganda Employers, whom we have worked for quite some time in a number of interventions, and they have been handy, and we are very excited with the amazing achievements which we have registered so far. Actually, they have gone beyond our expectation.
Through reproductive health, I have been able to disseminate information to employees about maternal care, prevention of infectious diseases, HIV, like HIV, STIs. People have been so educated on how to prevent them. We have been able to use the condoms at times, because some men here didn't know how to use the condom, they did not know. But when SRHR came in, we even took demonstrations how to put on the condom. People did not know, the men. So the prevalence of STIs, it has lowered than before SRHR came in.
They always provide us with condoms and also testing for HIV. You know your life status. After knowing your life status, if you feel like you're urging for getting a lady, then you have to get a condom. They provide condoms, condom box everywhere. We just come and pick for free.
The males and female got to know that we have equal rights as human beings, and because of that, respect is there for both females and males. Then it has reduced that sort of stigma in the females looking at themselves as, if I would say, underdogs. But now they know what they can do. Males can do the same. It has brought about that equality, and it has brought about self-confidence in the females within the estate.
Moving forward, the approach we want to take is holistic. We look at everything that concerns the workplace. So workplace health more comprehensively. Also being conscious that the world of work has changed, meaning that the workplace could actually be somebody's home. So that changes also what you call workplace health. It means even the health of the children will be a matter of workplace health. It would mean when companies buy insurance policies, they need to cover the entire family. You're not just going to cover the mother or cover the father. What about the children? If the children are sick, the mother, of course, cannot also concentrate on work. The father as well can't concentrate on work. So we are looking to take this journey forward in a more holistic manner.
A lot of our labor force is women. So for those women who were young and about to give birth, they would have to take time off, go into Entebbe. That means transport, it means time away from work, it means stress. That mother now, when she came back to work, how was she going to breastfeed her child? That was a worry to her. So she can't think about the job when she's worried about her child being at home with who? It's expensive. So then we had our childcare here.
Daycare center kale tuyamba mu bintu bingi nnyo. Kati nga nze omuzadde kiba kinyamba obutaspendinga nnyo ssente, kikuyanguza omanyi ojja n'okebera embeera ya mwana eri batya, naye ate kati oba omwana ali waka obeera weebuuza gamba mwana namulese mulwadde oba ali batya oba yalidde biki batye, obeera nga kola ki weebusaabuusa, naye wabeera ano agamba nja kujjamu eddagala ssaawa zino.
It is very interesting that much as we were advocating with these companies to come up with policies that can allow services to be provided within the company, and for those who have health facilities within their companies to integrate sexual and reproductive health and rights in the service package they were offering. What was interesting is that a number of them adapted or adopted these policies very fast.
SRHR has been so helpful on outreaches. Yes, they could do cancer screening for women, free of charge. Actually, whenever those chances come, we tell even the outsiders, not only the company employees. Yes, because at the end of the day, for community social responsibility, we are supposed also to help the community around.
From the time the Federation of Uganda Employees and its partnerships came in for the interventions, which included supply of condoms, health education to our peer groups, especially those in the HIV section, the testing kits, especially the oral ones that can easily be used in the community, even at home, the family planning methods, especially those that are injectable.
When I conceived, I did my antenatal from here, free of charge. They took care of me throughout the whole pregnancy. I gave birth from here. And also, right now, it treats me, it treats my children, and also treats my husband.
Kati nga nze HIV positive, etuyambanga ku ddagala. Ate netukola kyeddagala nerituwa mu bujjuvu. Netufuna ddagala nekuwa nnaku abasawo kennyini ne bakukola ki? Ne bakuwa gundi advice.
Now since we formed that group PREV, people can even go to the clinic themselves. Help me with the product. So now that group has helped the company and it has helped even those people with HIV.
The benefit can only be great if you help your workforce to be healthy, strong, taken care of, and so that's what we do at Wagagai, and it's a win-win for both parties.
We have had good success working with our partners DFPA and RHU, but I think we can do better bringing a lot more partners on board so that we actually drive the agenda of workplace health collectively, also working with the ministry responsible for labor and others.